rather than trying to like build a product for, say, diabetes management, a product for cardiac rehab, let's build this platform which allows us to then deploy solutions for different use cases. And over the years, what's happened is that it has naturally sort of converged on what I would say are three sort of key solutions. The first one is remote patient management. Currently, at Chelsea Westminster, which is the largest HIV clinic in Europe, what they wanted to do was that they had a cohort of patients living with HIV who are stable. So they don't need to necessarily come into the clinic, very often. So they wanted to digitize the management of those patients. So using Health Machine, which is our platform, we set up, they call it Click, where the patient through their application can complete, I think once in 6 months, complete a questionnaire.
Right.
That is then reviewed by the nurse at the clinic, and they decide, if the patient needs to come in or not. If the patient comes in, they can book their own appointments. So if patient
Directly via your app?
Directly via our app. The nurse is already sort of prepped because she's already seen what the patient has answered. So then the consultation is a lot more efficient. So fundamentally, what they've been able to do is that they've been able to manage this cohort of around 6,000 to 8,000 patients without necessarily having to increase the staff. So the same staff is now managing a larger cohort of patients. So that's what we would call is remote patient management. And the second sort of category of solution that we deploy is we call it companion apps. So this is generally for life science companies where for different diseases, there might be blocks in moving from first line to third line. So the pharmaceutical company wants to provide a tool to the patient so that they can facilitate the patients moving from first line to second line to third line as quickly as possible, provided it is clinically indicated. So that sort of became the second use case. And the third use case is what we call as digital therapeutics. So these are essentially software products that can be used to treat a specific disease.